Okay, so here we are. We have two different categories, so just ignore this down here while I talk about this. The first one is psychotherapeutics. Now, this does have, we are going to get into antidepressants in just a second, but these are just different categories under psychotherapeutics that we're going to talk about. So the first one is antioxidants, which is going to help decrease anxiety in your patient. You have buspirone, which is Buspar. The method of action is unknown. Patients need to take this daily. It's not a as needed medicine. It's non-sedating and non-habit forming. It may interact with other SSRIs, resulting in serotonin syndrome. You cannot take it with MAOIs because hypertension can occur. And an adverse effect of buspirone is a paradoxical anxiety, dizziness, blurred vision, headache, and nausea. For mood stabilizing psychotherapeutics, we have lithium. This is specifically for bipolar disorder or manic episodes. This is a very, very narrow therapeutic range. It's 0.6 to 1.2 MEQ per liter. So I'm not sure what MEQ is, but that's what it is. It's 0.6 to 1.2. It's contraindicated in patients who are dehydrated because there's a low sodium levels potentiate lithium toxicity, and it's also contraindicated in patients who have renal dysfunction. The adverse effects of lithium include heart dysrhythmias, GI distress, tremors, confusion, somnolence, which is a coma, seizures, and death. So those are two psychotherapeutics categories, antioxidants and mood stabilizing drugs. We're about to get into antipsychotics and antidepressants in just a second, but hold your horses, we're getting there. So now we're going to talk about Alzheimer's. Nursing implications for Alzheimer's drugs is that this is not a cure for Alzheimer's. This is just going to help with symptoms. It's going to help improve cognition and function for the patient. Effects may not show themselves for up to 6 weeks afterwards. It's going to help improve patients' moods, and there's going to be a decrease in confusion. So the first drug that we're going to talk about is donepezil Aricept. I guess that's how you say it. This is a cholinesterase inhibitor. It enhances and maintains memory in your patient. It's a temporary improvement in quality of life. So just remember, these drugs are not curing Alzheimer's. They're just going to help with the symptoms and bad stuff that they're going to be thinking like bad stuff that they have. Adverse effects include mild GI upset, drowsiness, dizziness, insomnia, and muscle cramps. We also come over here to Memantine, which is Namenda. This is going to block stimulation of receptors in the brain. It's going to decrease or stop degenerative cognitive symptoms. Again, this is a temporary effect, but it may improve the quality of life in your patient. And adverse effects of Memantine is hypotension, headache, and GI upset. So those are two categories right here. We have psychotherapeutics and Alzheimer's drugs. These are the two types of psychotherapeutics that we're talking about right here, and we're going to get into some more in just a second.